Good afternoon, everyone. Welcome to our workshop this afternoon. It's Wednesday, June 26th. Hard to believe we're almost at the end of June. I'm Rachel Cobb with the Center for Professional Excellence here at Greenville Technical College, and I'll be the host today. Before I introduce our guest speaker, I'll just go over a couple of quick general housekeeping reminders. If you haven't done so already, if you'll just make sure you're displayed as first and last name, you can do that by selecting the right hand corner of the tile of your picture and then select rename. That's really just to aid us in the CPE with confirming PD credit for you at the end of today's session. We do have several ways for you to interact with our presenter today. We are going to direct you for questions to use that Q&A option on your toolbar. If you don't see the Q&A option, if you select the More option there on your toolbar, you should see that. That way we can ensure that we get all questions to our presenter and that those questions don't potentially get lost in the chat. For comments, other information, experience sharing, please feel free to use the chat. That is what it's there for. And then finally, we do have the reactions available on your toolbar as well. And just so you know, we have scheduled time for Q&A, and Sarah is prepared for that. So we will definitely be making sure to get to those questions today. Again, thank you for muting your microphones. I think we're all well versed in that now. Also, we are recording this, so a recording of this session will be available in the next few days as well. So now that we've got all the housekeeping out of the way, I want to introduce our guest speaker for today, which is Sarah Lambert. Sarah is an occupational therapy doctoral student at Presbyterian College. And as part of the program requirements, she is completing a doctoral capstone and experience, which includes implementing a program based on her research findings to determine the efficacy of the program to further future research. Sarah's focus today will be to educate faculty and staff on what autism spectrum disorder is, how college may affect students with ASD, and how faculty and staff can support and facilitate an inclusive learning environment for students with ASD to increase participation and performance within the college classroom. Sarah, we are so excited to have you joining us today to share your work and your findings and your recommendations about this very important topic. So welcome, and I'm going to turn it over to you.
Thank you. Thank you for that introduction. You said basically almost one of my slides, but it's okay. I appreciate the introduction. So welcome everyone. I hope you're having a great day today. I appreciate you taking the time to attend this in-service. It means a lot to me as a student in future research. Before we start, I want to preface that this in-service, well, you already said this, sorry, and there is also going to be a pre and post survey within this presentation. So if you, for some reason, need to leave before the end of the presentation, if you could please come back to the recording and review the slides you missed and take the post survey. Doing so will help with my outcome measures to ensure there are the same amount of pre-tests as there are post-tests. So then, to the next slide. She kind of introduced me a little bit, but I just wanted to introduce myself so you can know who I am and better understand my purpose for today. Like she said, my name is Sarah Lambert. As you can see, I'm an OTD student at Presbyterian College, and fingers crossed I will graduate this August 3rd. After graduation, I have a job in the in-home health setting, providing care to pediatric patients. I am also a Greenville Tech alumni. I studied at Greenville Tech from 2016 to 2019, so I did take that extra football year, but I am grateful for the experiences I had. GTC allowed me to grow at my own pace and support the development of my sense of self while transitioning into adulthood, which ultimately led me to where I am today. After Greenville Tech, I attended USC Upstate, which I think Greenville Tech has a transfer program with them as well. At Upstate, I received my bachelor's in exercise science with a minor in psychology. And during undergrad, I also worked as a behavioral therapist for 2 years. At the time, I knew I wanted to go into OT and had an interest in autism. So I literally just Googled job with children with autism and landed a position at Blue Sprig Pediatrics here in Greenville. This job increased my desire to go into OT as well as my awareness of autism and how it impacts an individual's life as well as those around them. Today, I am a 2-year hopeful, almost graduate of PCOT as a doctoral student. And like she said, we are required to complete a capstone, which is a huge research project. Based on our findings, we are to develop a program or intervention that is intended to promote closing the gap. So this in-service is what I've chose to do. I determined the gap to be that educators lack access to available resources that provide information on autism and how to best support these students within their classroom. So next, these are just the objectives for today. The purpose of this in-service is to educate faculty and staff on what autism is, how college can affect individuals with autism, and how inclusive learning can promote participation and performance within the classroom, ultimately leading to success among individuals with autism in higher education. So then we're going to move on to my pre-survey, which I know was provided prior to today, and I'm not sure if everyone was able to do it. So I just wanted to allow some time for you guys to do it now if you weren't able to. If you have any questions while taking this survey, please don't hesitate to ask me. It may be confusing to you, and if it is, it's probably confusing to someone else. It should take less than 5 minutes. When you finished, or if you have already taken it, if you could put a thumbs up emoji in the chat so I know when to move on. So what is occupational therapy? As an OT, my role is to assess challenges in an individual that may have difficulty doing daily activities and things that are meaningful to them. And then I create interventions to address those challenges. And I actually found this beautiful analogy that explains what OT is and what we do. It is by Katie Mary. And she says, picture a wall in front of you, as far to the left, as far to the right, and as far high as you can see. In that wall, there's a door, and that door is locked. On the other side of the door is what makes your heart happy, playing with your kids, sewing, taking care of your dog, taking care of yourself without any help. It could be anything that makes a bad day not so bad anymore. That's your occupation. Some people are born lucky and have their key and can walk through the door their whole life without a problem. Other people aren't as fortunate. They've either lost their key or never had it to begin with, and it is my job to get them through that door. If I can't, we bust a hole through that door and make a new one. So you're probably wondering, what is occupational therapy doing in college? So actually in higher education, OT professionals can provide generalized services for the whole campus, including services related to accessibility and inclusivity across the entire campus. OT treatment services that are currently being provided in higher education are such as life skills training, occupational skills and development, coping skills, coaching, leisure exploration, sensory interventions, executive function interventions, and anxiety management. OT is a valuable consult role for advocacy and policy development at the institutional level by providing input on policy building design and campus access. And so this is actually a study that I read, and these are quotes from professors taken by a study, and the study helped actually jumpstart my research. It's a mixed methods approach by including 2 studies utilizing complementary methodologies, and I'm going to discuss the second part of the study. The second part of the study included 132 faculty members, and the purpose of the second part was to obtain more information about faculty knowledge about autism spectrum disorder and to learn whether their pediatrical practices accommodated students with autism spectrum disorder. There are 7 themes that were developed, and these were invisible disability, disability services, extra accommodations, interactions in regarding to student services, difficulties and issues, providing services, knowledge, positive interactions, negative interactions, interest in autism, and education and training in autism. So the first quote is, I have no idea which students in my class have had autism. I am simply assuming based on the frequency in the population and the number of students I teach that must have had some. I don't care whether they do or don't, just if they can learn my subject. The second one is my spouse works with special needs children at the elementary level, which has increased my awareness and sensitivity to issues faced by people with autism spectrum disorder and other special needs beyond that most other faculty I interact with. And the last one, for students who need accommodation are simply those whose behavior will seem significantly different in the classroom. Notifying the teacher early in the quarter would be helpful. I had a student several years ago who self-identified as Asperger's, but only in the 9th week. His periodic disruptions and attention difficulties would have been easier to understand and respond to if I had known why, and I would have been more patient and supportive, and in quotes, instead of annoyed. So in this study, faculty participants indicated that more education resources should be available to increase professors' understanding of how to best work with students with autism. With that being said, a major benefit of increasing awareness of the potential issues faced by those with autism is that students with related disabilities may also benefit. For example, improved class structure and clearer communication would benefit students with other neurodevelopmental disorders or mental health problems, such as ADHD and anxiety and depression. Lastly, the study concludes that while we cannot expect all faculty to be experts in ASD, our findings indicate the need to bring the concept of neurodiversity to the forefront in college classrooms. I have been in the disability service offices on campus at Greenville Tech, and Gina Terry, who's the Director of Disability Services, has been providing me support and knowledge as my mentor. She initially told me that this resource has been warranted by many faculty, and we were setting up this meeting. The lady over professional development, or I guess you guys call it continuing education, or Center for Professional Excellence, also mentioned many faculty have requested services specifically on the topic of ASD. While on campus, I did a little digging to see if my research was matching up here at Greenville Tech. It is known that students with ASD tend to not apply for services because they don't believe that they need them, while others may apply for services but never utilize them. Fall of 2023 and spring semester of 2024, 93 students with ASD applied for services, but only 9 utilized these services. This information can create the start of a whole other research project that I could do, but based specifically on my research purpose, this finding validates my findings and can suggest that faculty and staff must be well equipped in the knowledge of ASD and how to effectively support their learning, because these students are not always utilizing disability services. Sometimes what students need, disability service cannot provide, and we'll discuss that later on. So this is the definition of autism spectrum disorder. It's a neurological disorder seen commonly in boys. Symptoms of ASD have 2 clusters and primary categories of functioning: social communication and social interaction, which is one cluster, and then the other cluster being restrictive, repetitive patterns of behaviors. And also intellectual disability and autism spectrum disorder frequently co-occur. So like you'll have a student with autism, but they may have a learning disability, or they may have autism and they may have ADHD. It's important to know that ASD does not look the same across the board and is very diverse in its presentation. So I've also included a video.
Autism, also known as autism spectrum disorder, is characterized by symptoms that include impairments in social communication and interaction and restricted and repetitive behaviors. Although the neuroscience of autism is still poorly understood, autism is considered to be a complex developmental disorder that involves atypical brain organization starting early in development. Individuals with autism often experience a period of unusually rapid brain growth in infancy and early childhood. This accelerated brain growth is linked to an atypical pattern of connectivity between brain regions. A number of studies report that alterations in brain circuitry involved with social interaction and attention can be detected well before the symptoms of autism begin to appear. At this point, however, it's unclear how brain overgrowth and atypical connectivity might be linked to the occurrence of autism symptoms. Research suggests that the risk of autism is strongly influenced by genetics. Yet studies consistently report that environmental factors also play a large role. Although a number of potential environmental factors have been identified, the risk factors for autism are far from definitive, and it remains unclear which factors are responsible for causing an increase in autism risk and which are associated in a non-causal way. The risk factors that are most strongly linked to autism are associated with the prenatal or perinatal period. Thus, it's possible they might be responsible for disruptions to typical neural development, leading to symptoms of autism months or years later. How these risk factors might interfere with neural development is still uncertain, but hypotheses have suggested potential mechanisms such as epigenetic effects, inflammation, oxidative stress, or damage caused by oxygen deficiency. More work needs to be done, however, to fully elucidate the genetic and environmental risk factors for autism, as well as the mechanisms for the development of autism symptoms.
So this is the role of students in the school rules. And so students are expected to be on time, follow school rules and code of conduct, respect the rights of others, and so forth. So now that you have the definition of ASD, and let me restart. Now that you have a definition of ASD, think about its effects and how it may impact the performance of roles of a student. Students are held to a high standard, especially in college. College is difficult for those who are typical. Students are transitioning into adulthood, and some are adults who are trying to better themselves and or for their families. Understanding what expectations students are held to, it can be helpful to put things into perspective and make you think about how college may even be more difficult for a student with ASD. So these are some of the strengths of a student with ASD, and one of those is out of the box thinker. And this could be, for example, I've seen this thing where people are like, what do 2 and 7 have alike? And some people have been going to in-depth things saying that like 2 and 7, they look similar if 2 is flipped and reversed, or they both have 3 points on them, when in reality, the simple answer is just they're a number. And that's just a way to explain out-of-box thinkers. Having ASD does not automatically mean the individual lacks intelligence. Individuals with ASD are known to be well-versed in subjects such as math, science, and history. I actually had a patient who was either 5 or 6 on a rotation, and he could multiply, I think it may have been up to 3-digit numbers in his head, and I was completely amazed. He even one time corrected me that a diamond is actually called a rhombus. He also watched and memorized number blocks show for fun. He could tell you what it said front and back. And another strength is visual spatial skills. And this is the ability to tell where objects are in space. For example, one would be able to imagine where a toy is before they get it. Individuals with exceptional visual spatial skills may be good at certain jobs, such as being an engineer, a sculptor, a sailor, a surgeon, or a painter. Another strength is the ability to maintain a prolonged, intense focus on subjects of interest. This can also be referred to as hyperfocus, which can be confounded with perseveration. Terminology can get confusing with autism because there's an increase of autism and it's looking so differently for everyone. And autism can sometimes have the traits of ADHD. And we know that they are both different, obviously different diagnoses, but have similar presentations. Another strength is rote memory, which is learning a technique where students repeat certain facts or figures until it's instilled in their memory tank. The concept behind the strategy is that students will be able to quickly recall the meaning of the material the more they repeat it. In school, we always said proximal stability before distal mobility. We said that constantly, so that is like engraved in my brain just naturally now. And so, okay. And so this is a girl from TikTok, actually. She was on Love on the Spectrum. She's from here in Greenville. She is an autistic therapist. I think she also worked in ABA like I did, but she's also an advocate speaker. I enjoy watching her videos because they are super informative and reliable. Considering she has autism and a learning disability, she provides a platform that is open and allows individuals who are disabled and non-disabled to share experiences and ask questions. She creates scenarios, images, and ideas for the audience to connect with the topic to support their understanding of the information. I wanted to show her page because in the next slides, I will be referring to and utilizing some of her analogies she shared on TikTok. Sorry, technical difficulty. Okay. So how might a student with ASD appear in the classroom? They may appear attentive or bored, and this could look like they're drawing rather than taking notes. They may seem ritualistic and have repetitive behaviors, trouble staying on topic. They may have literal interpretation of words, which we also refer to as concrete thinking, so they may not understand sarcasm as well as others do. They may have trouble utilizing appropriate coping skills, and they may have difficulty manipulating utensils like in the lab courses, and they may also ask irrelevant questions and require redirection back to the task or topic. And another one is they may have difficulty working in groups because of that lack of social communication and social skills. So this was one of Kaylin's analogies. So imagine you are mentally on a boat that you view as your coping skills. This boat keeps you afloat and allows you to think before making any decisions. But sometimes there's a bad storm and water can enter your boat, causing you to sink. Picture this: your boat is floating steady when you begin your Monday morning, and you don't plan on a storm coming. You enter the classroom immediately, you receive your exam grade from last Friday. It was bad, even though you studied for hours for the last 2 weeks. The exam was heavily weighted, so you know it brought your grade down. The storm starts. A class begins, and you feel your heart rate increasing, your palms getting sweaty, and you're scared other students will see your grade and start talking about how bad of a grade you got. You begin to panic. The storm gets worse, and your boat starts to sink. You then get cold called by your professor to answer a question from last night's reading that you forgot to do because you had another important task to complete. The storm gets even worse and your boat begins drowning. You then lash out at the professor, telling him his class was dumb and that he graded your exam incorrectly. You slammed your exam on his desk and walked out. Your boat has completely capsized and you lost all the ability to use your coping skills. So here I have like the boat and it's drowning, and your coping skills are like your oxygen. And when you lose that oxygen, you have poor communication, difficulty problem solving, and a constructive manner. And this may often occur with students who have autism. So this is types of coping skills. Coping skills are used to reduce unpleasant emotions and can support getting through tough experiences and provide individuals with control over their situation. Finding what works can be the key to successful college experience. In the previous scenario, the student could have utilized breathing techniques, dismissed her or himself from the class until he or she could calm down, or the professor could have waited to share the exam at the end of class. I know that's not always possible to share the exam at end of class because you may want to go through it, but that is just a suggestion to prevent that from occurring because I've been in that position before. And so this is the difference between equal and fair. You can see that everyone on the left side has the same box, but the person can still not see to see the game. But on the other side, it's fair and they have enough boxes to where they can see. Understanding fairness and equality goes hand in hand with increasing students' tolerance and appreciation for diverse learners. Fairness means treating people according to their needs. This does not always mean it will be equal. Equality means treating everyone exactly the same. Similarly, equity is the quality of being fair and impartial. Fact is, fair cannot always be equal because children may vary in their many needs at any given moment, at any given time. And to treat every child equally would mean ignoring their individual sets of needs. If you think about a doctor and that doctor was to give everyone the same Band-Aid despite your situation, that would be unfair. That would be giving equal opportunity, but not fair. We want to have a classroom where there is an equal opportunity because that is something a teacher can control. We know that our students are there to learn in our various backgrounds of walks of life. We need to create an equal, inclusive environment so that all students have the opportunity to learn and be successful. And again, referring back to Kaylin, she had mentioned that disability has a way of restricting people's access to opportunities that are meaningful to them. Accommodations are sometimes the only way a person with a disability can access opportunity. So inclusive learning for students with ASD. Some of them are communication skills, and I'll put in like bold letters, unclear is unkind, because when you're not clear on what you want, that student struggles to know how to meet your expectation. And that's not fair to them, like not having a rubric. They're unsure which direction to go in because there's no direction to follow. So you can't just assume that the student may or may not understand. Social skills, allowing breaks during class time. I'm not sure how long classes usually are at Greenville Tech, but I guess mine were about an hour and a half now, and we were given like a 5 or 3 minute break every hour, which was really nice. And it was just to get up and just walk in the hallway for a couple minutes really helped my attention span. Sensory differences, and I know that some of these things aren't allowed in the classroom, but you can, as a professor, you could figure out what works best for you in your classroom. But some are allowing hats, tinted lenses, earplugs. I have seen those like anxiety rings, those aren't as noticeable, and devise a plan to address urgent sensory issues. So if that kid was having a breakdown, what plan do you have set in place to help him and be able to help him calm down? Motor skills, allowing a computer for in-work class, allowing work assignments done at a slower pace, provide models and step-by-step instruction. And there's also learning styles, pair with peer mentors for feedback, work checklist, ongoing structure, hands-on learning models, and providing reinforcements. What's needed by people with disabilities is what all people deserve. Teachers can and should do more despite disability and accommodations. You can ask yourself what changes can be made so that everyone really can access this. If an accommodation is one of those more specific individualized ones, use Google to refresh your memory on what fair and what equal is. They are not the same, and you deserve to know how to tell them apart. Some ways to promote inclusive learning is, like I mentioned, the rubrics and a syllabus of the due dates, the topic of the day, and don't put too much on the syllabus because sometimes it can get confusing. It's best to be very clear and concise. Sometimes less is more. make sure the assignments and due dates and requirements match up with what's on Blackboard. I've experienced where I have assignments, due dates on my rubric or my syllabus, and they don't match up to Blackboard. Sometimes they're a year ahead or a year behind, and that can be very confusing when trying to plan out your week. And then the other one is open line of communication. Make sure you emphasize when office hours are available and the level of support you're able to provide that student. Because sometimes relationships, specifically with individuals with autism, can kind of get blurred, the lines there. And we want to make sure that it's still being professional, but that child is still receiving what they need from you. So luckily, there's a framework with guidelines on how to provide an inclusive learning environment. It's called Universal Design for Learning. This started in architecture and in buildings following ADA regulations and expanded its way into K-12 education as well as higher education. This design is beneficial for individuals with ASD, but also for all learners regardless of ability. With growth-oriented mindset, universal design learning fosters expert knowledge for an individual to critically think inside and outside of the classroom. This design does not eliminate the need for special education services and support for students with disabilities. It is a necessary support for students with disabilities and can be a beneficial option for all students. For example, a student's accommodation may mandate the use of audiobooks in place of textbooks. While this option is required for this student, it may also be beneficial for other students. So you could play the audio in class to not single out the student, and maybe if it's available, you can offer the free audio to download for all the students to be able to access. This creates equal opportunity. And then, so just those broken down, we have multiple means of engagement, which is the why. These students want to know why they're learning this, what's the purpose behind it, because that then increases their motivation to pay attention in class, complete their assignments, and complete those assignments to the best of their ability. So you want to invite students to choose their own topic for an assignment or project, incorporate authentic activities that reflect real-world situations, generating multiple examples to connect new content to students and backgrounds and experiences, creating opportunities for peer interaction and collaborations. My teacher did like popsicle sticks, and that's how she created our groups, which is a great way for all of us to connect, because sometimes people tend to choose the same people, which that's just not how real life works. You're going to be working with different people of different personalities. And so the next one is multiple means of representation, the what of learning. And this you can do by presenting alternatives to text-based information, displaying video captions, hyperlinking definitions to new vocabulary in a text, offering a text-to-speech software, which I believe disability services can do, and then providing graphic organizers to guide information processing. Anything that can support their what of learning and how they're able to understand that information. And lastly, the multiple means of action and expression, which is the how of learning. It also kind of incorporates the why of learning. This allows students an opportunity to demonstrate their understanding of the lesson. So instead of just doing exams, you can provide an alternate way to show that for students to represent that they've been learning and they actually understand the information. We really enjoyed like doing Kahoot in classes, or we enjoyed like picking topics and then writing things up on the board and sharing them, or doing a peer like reading and then sharing it with another peer and then sharing what we both learned with the class. So I'm sure you're probably like, how in the world do I do all this? Well, they also have an instructional cycle. So the first step is to anticipate learner variability, remove barriers, analyze the goal, and align the design. And the next step is to communicate the goal, facilitate learning experiences, and empower expert learners. And the third step is to reflect on the goal, evaluate assessment methods and materials, and plan for improvements. So if like students did really bad on an exam or bad on an assignment collectively, then it's okay, something's wrong with an assignment. Maybe the directions were not articulated very well. Let me go back and look and see what I can fix. And then to finish up, thanks guys for hanging on with me. I just wanted to add in this quote. Only 29% of autistic people are in any type of employment. Autism acceptance isn't just about celebrating autistic people for a day, a week, or a month. It should be about leaving a space at the table for them. Nothing changes if nothing changes. And then these are my references. Is there any questions or comments? I don't think there was any chat. But then, so perfect, we can move on and do the post survey.
All right. I see a few people are completing their survey. If you're still working on that, please feel free to keep working on that. Sarah has shared her email in the chat. So if you'd like to continue the conversation, send questions, etc., be sure to grab that from the chat. We'd like to open it up if you have questions, comments, etc., that you'd like to share. You can either put that in the chat. Again, we'll use the chat since we are a smaller group today. Or if you'd like to unmute and share, if you will just use the react option to raise your hand, that will allow us to know you'd like to do that. And we will invite you to do so. So our questions and comments portion is now open. And we'd love to hear from you. I know Sarah is ready to answer your questions. Sarah, we had a question come in the chat. I've seen TV commercials for autismspeak.org/workplace inclusion now, and wondering if you've had any experience with that program.
I don't know if they were with Autism Speaks, but there was an adult daycare program for individuals with disabilities here in Greenville. It's like where Berea is, and they may be connected to them, but I haven't had any personal experience with Autism Speaks. I've usually been with little kids and up until now.
Great, and thank you, Karen, for sharing that.
And
And
thank you for the question.
yes, Wendy, I see your hand is raised. I want to invite you to unmute.
Yes, Sarah, thank you for presenting this. This is so powerful, and I don't feel like we've addressed it enough. I have a family member that's autistic. He's extremely brilliant. He's a savant. He can some of the things he can do is I can't even explain. Give him a date, and he can tell you what day that was 200 years ago. But the thing that has been concerning is, you're right, employment of autistic. Are there any programs working to, he is employed, but not, it is questionable. Some of, employers need to be understanding and comfortable with these employees. Are there any programs to help educate employers in hiring, how powerful it is to hire someone?
Yeah, so I know that Clemson Life does something like that with their college students. There's also voc rehab specialists that will speak with the individual and determine what job would best fit for them. And that adult daycare program, I really need to look that up for you guys. Maybe I can send it in an email, but they actually allow these adults to come in and work for money and gain money that way to be able to spend on what they want. And there was a place that I did a rotation at. It's in Seneca. I know that's kind of far from here, but it's called the Tribble Center. And those individuals actually do work. It's a very small amount because a lot of them are on Medicare or disability. So they can't make a lot of money, or then their disability will be taken away. But I know Tribble Center, they do that. And they all actually live there, and it's in walking distance.
All right, thank you. Appreciate
Yeah,
that.
of course.
All right. Anyone else have a question or a comment that you would like to share or discuss or ask Sarah?
It was called Thrive Upstate.
Thank you. Thank you for that information.
We volunteered there, and I really enjoyed it.
All right. Well, what we'll do is we'll bring this session to a close, but we will leave the meeting open for a few minutes after we close and stop the recording. So if you would like to hang around and talk with Sarah or ask a question after we've wrapped this up, we'll make that available to you. We won't close out the meeting right away. Sarah, we really want to thank you for being with us this afternoon and for sharing what you found, especially what you found in regards to our students here at Greenville Tech and the percentage who are applying for the assistance versus the percentage who are actually utilizing that assistance. I know you've given us a lot of strategies, a lot of things to think about as we're planning moving forward. And we just appreciate you kind of opening this conversation up for us back here at Greenville Tech. And we're looking forward to continuing that conversation moving forward. It is such an important topic. So thank you so much for being here. We really appreciate it. And we're glad that we could be a part of assisting you in your research.
Yes,
as
I
you
really
get
appreciate it.
that.
This was the first time I've ever done something like this. So sorry if I rambled or spoke too fast or wasn't making any sense at one point. But if you have any questions, you can email me.
Well, you've got some kudos in the chat. You did a great job.
Thank you.
Really enjoyed it. We will make a recording of this available. So if someone you know missed it and they wanted to see it, you want to share it, or you just want to go back and review because it was packed full of helpful information, that will be coming available from CPE within the next week. Give us a chance to get the recording and get it ready for you. So I will bring our session to a close. Thank you all for joining us. Again, we'll leave this meeting open for a few minutes afterwards in case you'd like to talk with Sarah. But thank you for joining us. We're so glad to have you this afternoon and have a great afternoon. We'll see you soon.